the backdrop. Naomi!
Yeah.
What's wrong with it?
Well, the words are completely jumbled. What? You can read that?
Of course. You okay?
No. Oh, God. I could be having a... what's the mnemonic? F is for face. Is my smile crooked?
What are you doing?
A is for arms. Arms.
You should really sit down. Can someone get us some water?
S is speech. I'm slurring. I'm slurring. Huh? F-A-S-T. T is time. Hurry, somebody, call 911. Tell them the vanished truck.
Welcome to the world of maternal mirror syndrome. Mom's body is like an intricate German metro system. All the trains run on time. When she gets pregnant, it's like a new station opening in Dusseldorf. Bunch of rookies running things, bound to be mistakes. Kids playing the tracks get electrocuted. Before you know it, trains are backed up all the way to Berlin, and you get a bunch of angry Germans with nowhere to go. We all know that ain't good for the Jews.
Who are the Jews in this metaphor?
A few things can happen to a fetus in distress. It can become a miscarriage, stillbirth, very sick baby, or on rare occasion, a time bomb. It kills mom while it's dying. Good news is, we fix the fetus, mom gets better. It's the diagnostic equivalent of a 2-for-1 sale.
You said sedation was risky. This sounds insane.
The injection goes into the umbilical cord.
The baby won't feel a thing.
Fetus. And lowering expectations. It works here and on dates. The benefits outweigh the risks, and the paralytic will wear off in an hour, okay?
Must be easier to hear you might die than your baby might die. But if there's anyone I would trust to save my baby, it would be Dr. House.
Fetus.
There's a blockage in the urinary tract. Simple terms, your baby can't pee. His bladder is swollen and it's crushing his lungs.
Well, can you fix it?
We can insert a small tube in the baby's bladder that makes the urine come out straight through his belly for the duration of the pregnancy. The bladder decompresses and the lungs will be able to develop normally. When the baby gets better, you should get better. First, we just have to do a test to determine whether the baby's kidneys are functioning properly.
And what if they're not?
If they're already too damaged, then there's really nothing we can do.
My stomach is killing me.
It's not a stomach.
Can you open your eyes, Emma? I just need to take a look.
The swollen bladder was not the only problem. You can't leave it inside you. We have to terminate.
Well, can't you deliver him? Put him on a respiratory machine till you figure out what's wrong.
We can. It won't matter. The fetus is still at least 2 weeks away from being viable.
Oh, well, I'll suffer through this for 2 more weeks then.
You're on dialysis for your kidneys. Your kidneys can wait. They don't make dialysis for your liver. You're not gonna make it 2 more days.
I'm not gonna let you kill my baby.
It's killing you.
I'm not having an abortion.
It's not a baby, it's a tumor. I understand dying for a cause, sacrificing your life so your child might live, but that's not the choice here. Either it dies or you both die.
Or you fix him and we both live.
I can't fix it. I'm scheduling a D&C.
I won't consent. So I guess you have 2 days to figure it out.
What if our original assumption is wrong?
It isn't.
If we assume she doesn't have mirror syndrome, then terminating her pregnancy isn't going to help her liver at all.
We eliminated all other possibilities.
The fetus is hydropic and in distress. Emma's kidneys and liver are failing. The diagnosis is solid.
Wow. The ass kisser won't agree with you. You must be eating wronger than I thought.
Fine. Let's assume she had mirror syndrome, but we fixed it when we fixed the baby's bladder. That means that her failing liver would be completely unrelated. If it is, we can fix it, and we don't have to terminate.
So her theory is that our patient's liver problems were just a giant coincidence.
It's not a surprising coincidence. Pregnant women can develop liver problems. If this is the case, we can actually do something here. Don't you guys think that's worth exploring?
Acute fatty liver of pregnancy would have the same symptoms.
Thank you.
Brown noser.
Viral hepatitis, HELP syndrome.
Oh, look. Sticking up for your girlfriend. Who says chivalry's dead?
We were able to control the preterm labor with tocolytics. The contractions have subsided for now.
And the liver biopsy was negative. This is definitely Mirror syndrome. Her baby's doing this to her.
We're out of options.
Did the biopsy cause the preterm labor, or did it happen on its own?
It doesn't make a difference.
Preterm labor can be a new symptom. New information gives us new theories. Isn't that how it works?
Not in this case. Her body's trying to do what you refuse to. Get the baby out and save itself.
Patient's transminases are 10 times normal. Her liver's on the verge of shutting down completely.
A torch test could...
We don't have time for more tests. We have to terminate or she'll die.
What do you think House would do?
House wants to terminate.
I mean, if he didn't, if he shared my position, what do you think he would do?
He wouldn't share your pain. He'd be objective.
Right. He would prioritize his problems.
He'd terminate.
He wouldn't be afraid of screwing with her lungs if there was a bigger issue.
There is no bigger issue. She needs her lungs.
Not right now. She's already on a respirator. The machine is breathing for her. I can do whatever I want to her lungs. If you're playing catch in the living room and you break your mother's vase, you may as well keep playing catch. The vase is already broken.
Yeah, except that room can't breathe without that vase.
Putting her back on corticosteroids.
His lungs are still 2 weeks away from being viable.
But big enough for a diagnosis.
These tissue buds are new. Could indicate bronchopulmonary sequestration or diaphragmatic eventration.
I was thinking bronchogenetic cysts or bronchial atresia.
Be lung lesions. We're gonna do open fetal surgery. Open the uterus, cut out the fetus so we can look around. I know you can't talk, so I need you to look petrified if you consent.
The umbilical cord won't be cut. During surgery, your body will basically serve as the baby's heart-lung machine. We find what's wrong and we fix it, if we can.
Don't lower expectations if you want them to do something.
She should know what she's facing. This is incredibly dangerous. It risks both your lives. The only reason why we're suggesting it is because there's nothing else we can do.
So my kidneys, liver, and lungs are all fine, just like that?
Just like that.
That's amazing.
What's amazing is how blonde your baby's hair is.
My baby?
You know, the thing in your belly that tried to kill you.
You've never called him a baby before.
Any pain?
Nothing I can't deal with.
You can only get out of bed to pee, poo, or shower, and absolutely no sex. So stop flirting with me.
Sorry. So this really worked. He'll be normal.
You call being born twice normal.
Hey, thank you.
Don't thank me. I would have killed the kid.
So the way things fell, this support beam's now holding up a giant pile of rubble. We can't lift it without jeopardizing everyone down here. So it's time to discuss amputation.
No. Please listen to me. You've been down here almost 2 hours. By the time they clear away the rubble...
We're not cutting off her leg. You don't have to rush through this to make his job easier.
You kidding me?
We leave the leg pinned, we're risking crush syndrome.
What's that?
Your leg isn't getting enough circulation. The longer it's pinned, the more the muscle dies.
So what does that mean, like a limp?
Dying muscles release poisons. We free your leg, the poisons rush back into your system. It could stop your heart.
So could cheeseburgers. Just get your lazy friends to start moving that pile. She's got 2 more hours before crush syndrome could possibly set in.
We're digging up there by hand. I can't guarantee I can get 10 tons of debris pulled off in 2 hours.
Well, you need to try. It's my leg.
Look, it's not just crush syndrome you gotta worry about, okay? There's gas leaks, there's fire. We can never rule out secondary collapses, no matter how much we shore this thing up.
You think chopping off someone's limb inside a pile of dirty rocks is safe? Sepsis, fat embolism, hemorrhage?
Those risks are nothing compared to the risk of this thing coming down again.
Captain, he's a jerk. That's what the patient wants. Can we please just give it a couple more hours? I gotta get to triage.
Thank you, doctor.
House, you don't need to thank me. It just makes sense.
Just promise me you won't let them cut off my leg.
I promise. Does that make you feel better?
For some reason it does. Thank you. I'm sorry I needed you.
Here, call your husband.
Charlie? I'm hearing they called you. They're helping me. Are you coming? I don't know how this could happen. It's your birthday. I'm so sorry.
See, this is why I lied about the phone. Your BP is spiking, so you're bleeding faster from your leg wound. We'll have less time to save it. Hang up.
Okay. Okay, they're telling me I have to go.
It was stupid on me.
It was nice.
I don't see that as a contradiction.
He was already on his way. He was in Baltimore and they all saw it on the news. How many people were hurt?
What did I tell you about not raising your blood pressure?
Can I ask what's wrong with your leg?
Grain fell on it. Small world.
You could have just said no.
I'll remember that for my next human contact.
Would you pray with me?
No. I'm not in the habit of encouraging my patients' superstitions.
How's that a habit? You plan on getting trapped under a building again?
I don't believe in God.
I don't either. Please. You think we could be friends when I get out of here?
Yeah. We'll catch a ball game or a group sex show or something.
Put the crewman in there.
Okay, when the beam starts lifting, you're gonna feel pain. It's gonna be like your foot's gone to sleep times a billion. You'll notice that I'm waiting till now to tell you.
Not ready. Lifting.
I'm feeling the pain already.
That's good. Some pressure's coming up. Closer to getting out of here. Come on. We're on. Come on.
It's moving.
Hannah, we have to amputate your leg.
No, you said that there was time.
There was, and it's run out.
No.
You asked me how I'd hurt my leg. I had a blood clot, and the muscle was dying. And I had all these doctors telling me I should amputate, and I said no. And they did this very risky operation. I almost died.
But you saved your leg.
wish I hadn't. They cut out a chunk of muscle about the size of my fist. They left me with this mutilated, useless thing. And I'm in pain every day. And it changed me. Made me a harder person. A worse person. And now I'm alone. You don't want to be like me. You got a husband who loves you. You got friends. You can start a family. You have a life. And this is just a leg.
Okay. Baby, I'm so sorry.
Shut up.
You always love my legs.
I don't care about your legs. Baby, I love you. I love you.
I love you.
Anna?
Heart rate 148.
Red 7's bilaterally. It's not another pneumothorax. Neck vein's flat. There's no tamponade. Damn it, I waited too long. Anna, you've got a clot in your lungs. I'm gonna fix this. IV streptokinase.
What's happening? What's going on?
Your body won't get any oxygen unless we can bust the clot. This is a blood thinner.
Is she gonna be all right?
We'll make her bleed more. We'll take care of that next. He's not busting the clot.
Maybe it's a heart.
It's not a clot. It's a fat embolism. And the amputation.
Okay, so what can we do? Come on. Do something. Please do something. Come on, guys, do something. Come on. Please, come on, do something. Come on, do something.
Bleeding ears. So your bleeding ears and raise you a total muscular degeneration.
What the hell?
I had a dream like this once. It didn't end well.
Huzzah, my loyal peasants.
House, what are you doing?
Filling in for Rabbi Shmuel at the Goldstein Bris. While I'm busy, you all can check out the Knight down in the ER, who instead of seizing the throne, just seized.
Works at a Renaissance festival?
Doesn't work there. He lives there. He's part of a wonderful little troupe who spend their weekends reenacting a nobler age when people crapped in the streets and 13 would have been a grandmother.
Weeks, not weekends. Says here he's been camping out for a month.
Try doing that with a pen.
Why don't you put that down before you kill one of us?
Better idea. Why don't you give me something I can use so I won't feel the need to?
Seizure right after a fight obviously suggests concussion.
Obviously it isn't, or the ER wouldn't have called House.
A full set of armor would protect against visible trauma, but not transmitted concussive force. Could be subdural hematoma.
You're forgetting to demonize.
An evil, satanic subdural hematoma.
No, to demonize. Hemorrhaging in the sclerae.
Could be an allergic reaction to something from the Renaissance Fair.
Which is why we need to check out Middle-earth. Foremen take Frodo and break bread with the hobbits.
I still think a hematoma is more likely.
That's why you and Chase are gonna get an MRI.
But you just...
I said Frodo, not Gollum.
Is he saying I have short legs or hairy feet?
I don't even know who Frodo is.
You sure he got sick from something here?
I'm not sure of anything yet, but... What do you make of this?
Looks like vomit. Means he was showing symptoms prior to the fight.
True, but like this.
Oh, it's a cow eye from the night before the tournament.
He makes the knights eat all kinds of disgusting stuff.
Why?
Got the idea from Fear Factor.
Why didn't he mention it when he checked into the hospital?
I make them all take an oath of secrecy about the ritual. William tends to take his role as a knight very seriously.
You think that's what caused him to pass out?
It's not exactly sanitary.
Fun stuff never is.
Serious bacterial food poisoning explains seizure and vomiting.
Lumbar puncture could confirm.
Except it's not food poisoning. If it was, the ER would look like Camelot right now.
All it takes is one bad eyeball.
Or testicle, cow brain, or my personal favorite, pig rectum with a side odor of sphincter.
I think they call that breakfast in Australia.
No one else was sick because they weren't allergic like he was.
To what?
That's what I sent you to Middle-earth to find out. Run scratch tests with the samples he brought back.
That's gonna take time and he's getting worse.
So treat him with epinephrine, too.
This should prevent any more symptoms until we can figure out what it is you're allergic to.
Thanks.
Told you shouldn't have eaten all that stuff.
You know, you don't have to stay. I'm sure you and Miles are crazy busy, what with the wedding and all.
Miles said we could postpone it until...
Don't worry, I'll be fine. I'll be there. Just hope you have a good photographer, because I don't think the standard red-eye filter is going to work on these.
I need your right arm.
That, feels strange.
What is it? What's wrong?
His heart rate's become irregular.
My chest hurts. It feels like it's going to explode.
Tachycardia. Need to shock him back into rhythm.
Oh my God. William?
I need his gown open.
What is it? What is it? Still?
I don't know. It's definitely not an allergy, or the epi would have helped him. That made him worse.
Unless he's allergic and allergic to the cure. Sodium bisulfite, the preservative that keeps epi peppy, can cause tachycardia.
So can Wolff-Parkinson-White syndrome, and it also causes hemorrhaging in the eyes.
And abnormal electrical pathways in the heart, which could cause seizures.
But not skin infections.
There is an infection that can cause skin and neurological damage and spreads rapidly without treatment.
Methicillin-resistant Staphylococcus aureus?
Lord have mercy.
You weren't wearing gloves when we shocked his heart back into rhythm.
I'm sure you'll be fine. You two get a sample to the lab to confirm. You get the night into isolation on IV antibiotics. You stay away from me.
It's not MRSA. It looks like some sort of clostridial organism.
The question is, which type of Clostridium? There's hundreds.
C. perfringens?
Wouldn't count for his other symptoms. C. tetani, on the other hand?
Tetanus, he would have been inoculated against it.
So he cut himself and didn't get a booster shot. The guy fights people with swords for fun. No one said he's smart.
They don't just fight for fun. They fight to prove their bravery.
You buying this honor stuff? Fighting's not brave, it's just stupid.
You would say that.
You think I've never been in a fight?
No, I just think you've never won one.
I took on 3 guys in college once.
Hope they bought you dinner first.
It's not MRSA.
I know. It's poison ivy.
Poison ivy?
A severe reaction could cause the blisters and maybe irritate his eyes enough to cause the hemorrhaging, but the chest pain and seizures.
They have bonfires every night. Burning leaves aerosolizes the oil. You've seen what it's done to the outside of his body. Imagine what it's doing to his lungs and his sinuses.
Okay, maybe it remotely fits, but I'd rather go with scientific evidence than with your gut.
How about this? Apparently, it's all over his sword.
It's his heart rate again.
How fast is it?
It's slowing. Why aren't you?
It's not MRSA.
Giving him 12 cc's epinephrine.
He tested positive. You'll blow his heart out.
If it slows anymore, it's gonna stop.
I told you.
And I told you.
That wasn't caused by poison ivy.
Or epinephrine. Means the heart problem we ruled out, we now have to rule back in.
Found Clostridium bacteria in the skin samples.
Clostridium's in dirt and basically harmless.
But opportunistic if his immune system was depressed.
Leukemia?
He would have had symptoms way before the Renaissance Festival.
Which is true of anything that would compromise his immune system. Which means it has to be some other environmental toxin. Yesterday he was a healthy knight, today he's sleeping beauty. Nothing else fits.
Trichinosis from eating infected meat.
We already ruled out food poisoning. Both the butcher shop and the food stands at the fair were totally clean.
And he ate the poison apple somewhere else. Or maybe you just missed it. Start treatment for trichinosis. Confirm with a muscle biopsy.
Where's it hurt, William?
My legs! It feels like they're on fire!
Our knight is into some seriously creepy stuff.
He claims it's just sugar water, but we sent the rest down to the lab for testing.
You think he poisoned himself?
It's not poison. We would have picked it up in his blood work.
Not if it collected slowly in his liver and it all started leaking into his system at once. These tumors that aren't tumors, what if they're focal hepatic lesions filled with blood? Every time one explodes, they'd be releasing another dose.
Of what?
Plumbum nigrum.
You putting a hex on someone?
It's Latin for black lead.
Our knight/warlock apparently also dabbles in alchemy.
Lead poisoning.
Seizures, paralysis, weakened immune system, and eventually coma.
Biopsy the cysts. We'll find your lead.
I cry your pardon, sir.
You know what this is?
Well, that's lavender.
Try rose hips.
Both harmless. Who cares?
Could be cyanide as far as he knows. What about this?
Be nothing but St. John's wort.
Wrong again. Black cohosh.
My uncle owns the shop. I just started apprenticing. What's the big deal? Hey, I just organized all that.
You know what this is?
A wild carrot?
It's hemlock. You embossed carbuncle.
That's hemlock. You sure?
Did you sell it to anyone?
It's poison. Think hard.
It was just one branch.
You sold it to Sir William.
No, to the king.
It's the only part of the environment you didn't check. The people living in it.
You shouldn't sign it. Postponing's almost always the smart thing to do. Tempers cool, memories fade.
They rule on me, it's done, right?
Yeah, but
Then let's get it over with.
have you ever done a peer review before?
No.
Good. Here's a misnomer. These are your bosses. This could cost you some money, some privileges, or it could cost you your career.
All I can tell them is what happened.
There's an objective reality to what happened, and that committee is never going to know it. All they're going to know is what they picture happened, which depends a little on what you tell them and a whole lot on how you tell them. May 11th.
Patient presented to the clinic.
What's her name?
It's in the file.
Do you know it? Then use it.
Kayla presented to the clinic with multiple joint and stomach pain. Dr. Foreman was called in for a neurological consult.
What's the point of this, man? Checking your sister's cerebral coordination.
The thing is in her leg and her stomach. Wait in the clinic for 6 hours so she can play patty cake.
Could have gone to the ER last night.
You can come over and babysit her kids?
Okay, patient comes from a family of jerks, I get it. Can you stick to the medicine?
Something wrong?
There was some uveitis.
Meaning?
Her iris, the color part of her eye, was inflamed.
Meaning?
Worst case, blindness. But there was an upside. It was weird enough to get House interested.
Young woman, joint pain, gonorrhea is a possibility.
It's polyarticular. Maybe rheumatoid.
That's typically small joints. This hit her knee.
Takayasu's arteritis.
Get a SID rate in serologies. Childproof. How many kids are hopped up on Vicodin?
Gimme.
Right. Like I'd ever get it back. Chase.
Don't care about the Vicodin.
Might not just be her arteries, could be all her blood vessels.
Vasculitis with stomach pain, so Behçet's.
No, she'd have oral sores.
Or genital. Go find them.
I thought she was Foreman's patient. Why did you do the exam?
She'd have oral sores.
Or genital. Go find them. Whoa, whoa, Foreman. Chase can handle the pelvic.
Any pain? Is it bad? This will go a lot easier if you talk to me.
I'm sorry. I just really hate hospitals.
When I was 12, had my tonsils out, got to skip school, lots of ice cream, made me want to be a doctor.
My mom died when I was 8, so I spent months at Princeton General.
She died of DTs, your mom? Bottles stashed around the house, mood swings, that whole deal.
You've been there?
My mom. Dad left, Mum crawled inside a bottle. Made for a great year 12 of high school.
You okay with your dad now?
No.
Does your dad have anything to do with this story?
No, it's just...
Okay, I get it. The two of you bonded, which is probably why you haven't been sued. Patients never sue doctors they like. But keep it brief, okay? The panel doesn't like to think they're being manipulated when they're being manipulated.
She had some ulceration.
Confirming Behçet's.
I gave her some prednisone, an antacid, and I ran a pathogy test on her arm. Takes 24 hours to confirm. Told her any doctor could check it out.
You didn't make an appointment?
Nope. She just showed up.
You wrote her a prescription, which means there was an examination. What really happened?
I was on the phone.
Dr. Chase? Hi.
Hi.
Kayla, I'm here for the test. My arm.
Oh, yeah. Okay. It's positive. Talk to Nurse Previn, get an appointment with Dr. Broston in rheumatology.
I took that medicine you gave me, but my stomach still hurts.
Behçet's could be stronger than we thought, or it could be reflux from the prednisone. It's a stronger antacid.
Doctor.
Yes?
Nothing.
You didn't ask her anything about the stomach pain?
I made one little mistake.
As little mistakes go, that was a biggie.
I'm in the stomach. There's too much blood, I can't see.
She burst an artery?
No. There. Bubbling, just a bad ulcer. Okay. Cauterizing. Looks good. Bleeding ulcer. We got it. She was fine 2 hours ago.
If by fine, you mean she had fountains of blood spurting out of every orifice, then yeah, I believe you. I'm guessing those are celebratory bells.
Systolic BP 70.
Show me the ulcer.
It's brown. I cauterized it.
Sweetback, show me the whole stomach. Stop.
Second ulcer?
Not anymore. It perforated.
Get it to an OR.
Let's go.
She was not fine 2 hours ago. Did you mention stomach pain?
Yeah, so I gave her a stronger...
You didn't do an exam.
She just came in for a follow-up. The results of the pathogy test.
Did you listen to her stomach? Check her vitals?
Maybe if she'd said something about taking ibuprofen, mentioned the rectal bleeding.
Yeah! Why didn't she go to med school like you did? Diarrhea, blood in the stool. These are routine questions.
The doctors skip all the time. It was a minor mistake. I couldn't have known it was gonna happen.
Mistakes are as serious as the results they cause. This woman could die because you were too lazy to ask one simple question.
No, she might die because I had the bad luck to spill your damn Vicodin pills.
I responded with a number of trenchant remarks which made Chase cry, none of which I'm going to testify about. Unless you convince Chase to roll on me.
Excuse me? Testify about what?
Chuck. I'm going to break from the parable of the wicked doctor and tell a little story about a patient. Let's call him Buck, who has low O2 sats and crackling lung sounds.
Like I have.
Buck has idiopathic pulmonary fibrosis. His lung tissue's turning to rock. There's no known cause, no treatment. He is slowly suffocating.
You're talking about me?
Lung transplant's about $500,000, but this poor sucker's got no insurance. If he tried to sign up now, he'd be excluded, pre-existing condition. But let me confirm with my lawyer. She confirms. If only Buck hadn't been diagnosed with fibrosis before he got insurance. So, back to the exam.
That's how you tell this guy he's dying?
Oh, relax. He's got a cold. And soon, health insurance.
Such a hero, always righting wrongs. Who cares who you have to manipulate?
I'm sorry. I didn't realize you and Buck were so close.
Diarrhea, blood in the stool. Two simple questions you could ask her 6 months ago and averted this whole thing. You didn't ask either. Why?
Judging from your question and your demeanor, I assume you were visiting with House. I've been over this. I don't know.
Good doctors don't make mistakes
Good doctors
like that.
never forget to ask questions. And you've got your answer. Apparently, I'm not a good doctor.
FYI, self-pity generally is not a good strategy in these hearings. What happened after the operation?
The kidney damage isn't so bad. The liver damage is more worrisome.
There's no dialysis for livers.
I know, but if she loses a liver, she can get a transplant, right?
We can put her on a list.
I could do it. I could give her part of my liver.
Surgeons won't operate unless the donor's had a long time to weigh the decision.
There's black markets.
For organs, that's just...
Oh, my stomach.
Pain constant?
Oh, yeah.
Sharp or dull?
Oh, I don't know. A little cold. She's got ascites.
No, it's a clot.
Nurse, call the OR. We got a prep her for an embolectomy.
CBC, PT, and a liver panel.
Forget it. We can't give a liver to a woman this sick.
Do you listen to what you're saying?
There is no point in giving a new liver to somebody who also has vasculitis.
Treatable.
And kidney damage.
It's healing.
You know what's really killing her? Chase forgot to ask a standard question about stomach pain, so he missed the diagnosis. So she perforated, so she got sepsis, so her BP tanked, so she got blood clots, so she lost her liver. Livers are important, Cuddy. Can't live without them, hence the name. And here's the big issue. Chase is a hospital employee, and Kayla is a sympathetic mother of those two jury-friendly moppets, Caleb and Cody.
Dory and Nikki.
Your point, beyond just trying to make Chase wet himself, seems to be that the hospital faces liability here. Well, thanks for clearing that up. I still need a medical reason to list her.
That is a medical reason. If the family wins this hospital in a lawsuit, they'll turn it into condos. And people will die waiting outside a condo for medical care.
Start praying for a 12-car pileup on the turnpike, because we're not exactly swimming in livers over here.
Mr. Chase, we'd like to discuss your case with you privately.
I'm his girlfriend. Is it all right if I stay for this?
Melissa can stay, and I've never had a seizure before in my life.
They can be mild, like a loss of concentration or a muscle tremor.
A lot of times, a family member notices before the patient does. I'm Dr. Park, by the way. I'm 5'2", Asian, and I'm totally cool with it if you want to fill my face.
Blind people only do that in movies.
But you sound nice, so if you want me to.
Her point was you may not have realized you were having a seizure, but maybe your girlfriend has.
No. But I haven't seen him for the last 5 months. We were on a break.
Like Rachel and Ross on Friends. Never seen the show myself, but I hear it's good. That joke usually kills my blind friends.
Will, this is serious.
No, it's not, since I don't have epilepsy. I have to pay attention to every signal my body sends or receives, or I'll end up taking a dirt nap. You don't think I'd know if I was having seizures? It's probably just low blood sugar.
If that's true, then you shouldn't have a problem passing our test.
He's seizing. Sound frequency's at 300 hertz.
It's not a seizure. He's not spiking on his EEG. He's not moving air. I think he's choking on something.
Blood. I don't see any blockage.
Let me move him.
Just relax and breathe.
What are these? I was wondering if I could ask you guys for a favor. I really need my laptop and braille writer, and I can't ask Melissa to get them for me.
Why not?
Because I want you to put this someplace safe.
It's beautiful.
People always say diamonds are beautiful, but to me they just feel cold. They have really sharp edges.
I guess convincing her to take a break was a good thing.
Well, the break was her idea. Melissa's the only girl I've ever dated. She wanted me to be sure before we took the next step.
Wow.
Yeah.
I know what's wrong with the patient. Illegal drugs, some kind of acid.
His tox screens were clean.
His apartment wasn't.
We didn't find any drugs.
Then why am I completely tripping balls right now? I'm seriously freaking out here, guys. Can't you tell?
You pretty much look the same you always do.
Take your glasses off. Pupils dilated. Pulse elevated. Hallucinating?
I think so, because he's a rabbit. Oh, I get it, because she's his wife. They flirt a lot. I've seen things. Taub is either a tooth fairy or rainbow bright. And you? You're just House.
She ate ice cream and gummy bears at the patient's apartment. One of them must have been dosed with it.
Go back and find the drugs. You two, find out where he bought them, and then MRI his brain. Check for infections, masses, and plaques.
How many times?
Maybe 5 or 6.
We need to know where you bought it so we can find out what was in it.
My girlfriend gave it to me.
I'll find her.
No, don't. It wasn't Melissa. I met someone else.
He's stabilized for the moment.
Coughing up blood, that doesn't really change anything. Hemoptysis is a symptom of Behçet's.
Except our treatment should make him better, not worse.
It could be doing both. Our treatment breaks down his clot in his head like it's supposed to, except a piece broke off and traveled to one of his arteries in his lungs. If anything, we need to increase the heparin to prevent further clots from forming.
We do that and he starts hemorrhaging, we won't be able to stop the bleeding.
If we don't do that, the next clot will cause a heart attack or a stroke. Park's way, he at least has a shot at living. CT his lungs to confirm and up the dose.
Somebody help me!
Will, it's Dr. Adams and Dr. Chase. We just need to know where you...
My eyes! It feels like it's on fire!
That's not a piece of the clot from his brain. That's the point of infection. Mucormycosis. He breathed in the spores. It's been growing and spreading ever since.
Fungal infection spreading this fast?
Kid's diabetic. He already has a compromised immune system.
He's right. The sample from his eyes is crawling with it.
Treat with amphotericin B.
We treated him with gentamicin when we thought it was bacterial, which means a dose of amphotericin B we'll need to cure him will probably leave him deaf.
Sorry. Stop listening after you said the dose will need to cure him.
There's a chance your hearing won't be completely gone.
How much of a chance?
A small one, but a chance.
I'm refusing treatment. You don't know how hard things are already for me. I can't handle anymore. Why'd you come back?
Because I love you. And I want to be with you for as long as I can.
Melissa, I'm so scared.
Me too. I'll always love you.
Even if I was deaf.
Even if anything.
Is it working?
He's still very ill, but if he keeps responding the way he has been, he should be fine.
And his hearing?
It's gone. We don't know yet if it'll be permanent.
Melissa? Is that you?
We've been squeezing his hand once for yes, twice for no.
Can I ask you something? I completely understand if you squeeze no. Will you marry me? Don't leave me hanging now.
Yes. Yes, of course, yes.
I heard that. You said yes, right?
Yes.
You said...
Thank you all for coming to Tribal Council. A man of your integrity I feel I can trust. Big love. And I don't call you that because you're a Mormon. So where's your team's sixth man?
She went rogue, broke the rules.
You also sinned. You have no right to cast the first stone.
And atheists have no right to quote scripture.
The rules said no talking.
I told them not to talk.
Out loud.
We were trying to save a man's life.
Keyword being trying. Tilt table test confirmed that you guys were wrong. fired. The prodigal son returneth. You're also fired.
We thought there was a tumor on the patient's esophagus. We were right about the area, wrong about the diagnosis. Turns out the esophagus is just straightening. It's scleroderma. Explains the syncope and the choking. He needs steroids.
You did a CT scan?
Obviously.
After you were already proven wrong?
For you. It's too bad you're wrong. Straightening indicates weakening, not hardening. SMA explains the weakening. Strongyloides infection explains everything else. You ladies have the honor to give the patient a feeding tube, discharge him, show up for work tomorrow. The rest of you, you're a disappointment. You make me want to stop dangling.
It was the best 2 weeks of my life.
I think I will miss you most of all, ridiculously old fraud.
Do you think House could be wrong?
I thought he fired you.
No, he fired the men.
I don't think he's wrong.
If he is, how would I prove it?
I just said I don't think he is.
Well, thinking isn't good enough.
You have to run a blood test for anti-centromere antibodies.
Would you mind running the labs?
You can't.
Well, I can, but...
No, I was making a statement. You've been fired, so you no longer have lab privileges. You weren't coming here for advice, you're coming here to con a favor to save your job. Sorry, I'm not working for him anymore, but he can still make my life miserable.
You have a chance to make his life miserable.
I'm insulted. You conned Cameron by appealing to her humanity,
I told her what she wanted to hear.
and you told me what you thought I wanted to hear.
If it's any consolation, I think your motives are more interesting.
I cannot believe he fired you. Go draw his blood. I'll meet you in the lab when I'm done here.
Guess you didn't find your tumor?
The other doctors tell you that you were fine.
Yeah. In a sense, it's just my disease getting worse. You come to terms with this disease. You know it's there. You know it's waiting. And every now and again, take something away. Took my walking. Took my modesty. Now it's taking one of my last pleasures.
There's an outside shot. That's something other than the SMA is causing your eating problems. And if it is, we can fix it and remove that tube.
Is that my blood? It's green. What does that mean?
It means I'm not fired.
All right, who's up? Not me.
You haven't done any digging yet.
I'm a surgeon. If anything happens to these hands, I'm screwed. Let Bosley do it. As long as he can keep folding laundry, his career won't. Someone's coming. Hey, should we be running?
If it's a cop, run. Security guard, I say we take him down.
Sorry, I'm late.
Where the hell have you been?
Oh, I got lost.
Been here over 3 hours.
Really lost. I brought coffee and donuts. So 13, you grew up around here?
Or digging up a grave and you want to chit-chat?
I'm just making conversation. It's what people do. Why are you hiding everything? And I'm asking you that question because you're hiding everything. There's something seriously wrong with you. I'm worried.
No, you're not.
Fine, but I am freaked because I don't think you're a freak. I think you're doing this on purpose because you know House will be intrigued.
Yeah, I grew up around here.
Honey, I'm home.
Get the crowbar.
No, there's not enough room to maneuver a crowbar down here.
Oh, God help us.
What the hell?
What is it?
Ankles. They buried the guy the wrong way around.
You guys don't wipe your feet when you come in the house? Doctor's lounge. Let's go.
Why me?
Well, I can't ask the black guy or one of the chicks to do it. That would be insensitive.
And you can't ask Bosley because that'd look like you only hired the non-doctor to do non-doctor stuff.
You keep stalling, you're still gonna clean up, but I won't let you have the mop.
Sample came back negative for Creutzfeldt-Jakob.
Well, that discussion didn't last long.
I just don't know what else there is. We had an idea. It was wrong.
Well, we could go home. I mean, we have no idea what's wrong with her, which means it could be completely benign. Or, on the off chance that it's killing her, we could take it again from the top.
You've already done everything.
We may have missed something.
I just want to go home. I'm sure I'm fine now.
Rina, the doctors know best.
You had some serious symptoms.
If I have another one, I'll come right back, okay?
If you have it while you're driving.
You can drive me. Make sure I take it easy.
Who can?
My mother.
Your mother's here?
What are you talking about? She's right there.
Sampled every bodily fluid, peeked in her brain, violated a cadaver's privacy, dug up a body, but missed the fact she was still seeing things that weren't there. Neurological symptoms are getting worse. It'd be nice if one of you angels/morons had a clue why.
We did a full history. She never mentioned seeing or hearing anything unusual.
Oh, well, as long as she never said anything. How are you to know? Same thing with the spinal fluid. She tell you that was fine?
The labs were all clear.
Then either we're about to meet the alpha and omega, or you missed something.
We missed the new symptom.
It's not a new symptom. We always knew she had hallucinations.
Seeing your dead mother's a hallucination. Not knowing she's dead is a delusion.
You keep this up, you're gonna have to start wearing sexier clothes.
Carbon monoxide could also cause delusions, a lot of haunted houses.
There's no headache, no tachycardia. I guess they didn't cover that at your medical school.
What about a hereditary connection? When she's 24, her mother died when she was 25.
In Ukraine 20 years ago, good luck trying to get those records.
So we start new records. Test for every hereditary disease that fits the symptoms.
There are at least 40 different mitochondrial disorders, another couple hundred.
Start with amyloidosis. You keep going until you reach zamyloidosis.